Hi, everyone. It's Carolyn Dolan with VitaKinetics. Hopefully, we're waiting just a little bit for people to get online for this live session of the science behind VitaKinetics and how it can help your clinical practice related to pain management, particularly in physical therapy. So we're just going to give it a few minutes. I know many folks are on their lunch break, and then we'll be sharing the recording. So you can share with your colleagues or friends about how VitaKinetics might be helpful for you in your practice as a complement. So we'll just give it a few more couple minutes. I'll be talking for about 30, 35 minutes. We have, so it'll be brief but intense information. All right, so I'm going to go ahead and share my screen. All right. Okay, so thank you for joining us. We're here at the science behind VitaKinetics and how to help optimize healing and reduce pain naturally. I'm Dr. Carolyn Dolan, physical therapist, and we'll go into a little bit more about my history. My goal today is to provide you as the clinician with information, or the consumer with information about our particular supplement, but also about the idea of how our treatments, how we need to inform our patients and consumers on the benefits, risks, and alternatives related to other pain management strategies, so that the patient or consumer or clinician can make an informed decision, an informed choice. So ultimately, that's my goal, is to share information. There's nothing here that says this is the only way for pain management. This is just an additional tool so people can make choices based on what meets their needs. Some disclosures. I am the owner of VitaKinetics. I have omitted specific research articles for the sake of clarity on slides. If you really want some of the specific science or the literature, you can often find it in some of our blogs on the website at VitaKinetics.com. Please feel free to email me at carolyn@VitaKinetics.com, and I can provide those resources to you. I am a physical therapist. I am not a dietitian nor nutritionist nor a medical doctor, and I don't claim to be anything other. The state of Nevada, where I am licensed, allows me to provide information related to lifestyle, nutrition, and supplements as it relates to physical therapy conditions. Every state is different. The state of California, which most of you are from, potentially allows a similar, it's within our scope of practice. You just have to have a posting clear in your place of business. But what I was suggesting here is that you check, depending on where you're from, with your specific board. For the sake of time today, because I know your time is valuable, this is going to be much like a fire hose of information. We're not going to give you lots of time to digest little bits here and there. There's not quite enough time for that, but hopefully what you walk away from this is an understanding of how VitaKinetics can help support your patients and provide you a boost in your outcomes in your physical therapy practice. About me, I have a bachelor's of science in biological systems engineering. I got my master's of science in physical therapy, and then went along and did a post-professional doctorate in physical therapy. I'm certified in mechanical diagnosis and treatment from the McKenzie Institute. And then I went back as I started to notice different lifestyle improvements personally to school to get a master's of science in holistic nutrition. And that, my work on my thesis work and my clinical practice at that point, is how VitaKinetics supplement and business was born. For my specific thesis project, what you see here is a canary. We consider this a sentinel species. A sentinel species is a mammal or an organism that is more sensitive than humans to a different environmental exposure. So the canary in the coal mine was a sentinel species for humans for carbon monoxide poisoning. So when the canary died within the coal mine or whatever, that was an indication, because they were more sensitive to the carbon monoxide as a poison than humans, to signal to the humans it's time to exit, get out to safety. And so I use a specific patient with chronic regional pain syndrome to really explore deeper into maybe potential contributing causes for developing that chronic pain state, to really understand what was kind of missing within our recovery process. And that led me to understand a lot more about something called intestinal permeability and how that leads to what we call an aberrant systemic inflammatory process. Aberrant meaning out of control, which can lead to excessive pain, reduction in healing, and that this is a contributing factor to the development of something like chronic regional pain. Again, I just use this as an example to understand and see where we could in that recovery process help facilitate better outcomes and reducing risk. So what is intestinal permeability? This diagram shows the enterocytes, which are the specific cells to the gut lining. And they are held together by tight junctions. And they have little cilia, which increases the surface area for absorption. In intestinal permeability, that tight junction gets disrupted to either make it more open so that different particles can get into the body. It can also, depending on what can be caused by a disruption of the cilia and the lining and a degradation. So you lose that barrier between what's coming in and out that we pass out through our bowels, and gets into the body and creates a inflammatory response. Now, things that don't belong in that area, food, non-broken down food particles, bacteria, fragments of bacteria, waste products, and even toxins. And that creates this problem of an inflammatory response, an immune inflammatory response. So what leaks in doesn't belong there. And so if we think about our immune system, our inflammatory process as an army of people, that if that army is now is told to, there's a bad guy out there, let's go get him. That army is disorganized and going out to attack anything and everything. And this is where part of that out of control inflammation, potentially autoimmune issues come in, because they don't know what they're looking for, versus the army that has a targeted approach, or some leader that says, hey, we're looking specifically for a person in a black hat and purple pants. Then we have a very targeted approach to, we know where the bad guy is, what it looks like. It's a very different process, right? And with this intestinal permeability, we don't have the organization of it. It's really far more out of whack and more excessive. And that's what can also lead to this brain inflammation, which creates problems for pain perception, which we'll talk a little bit about. And that brings us to the gut-brain axis, right? So that connection and that duality of communication from the brain to the gut, having the effect, the health and stability of the gut has an effect on the brain and the neurotransmitters, behavior, mood, stress, anxiety. And also the brain itself can then affect the gut on motility, secretion, nutrient delivery and absorption, and that microbial balance. So if we have a disruption of the microbiota or the intestinal area, that it has this effect on the brain. And so when we're talking about healing from injury or recovery, that we have this effect of excessive pain response, particularly in a chronic regional pain state. But this has, particularly in those acute stages or anybody who has some sort of recovery process, that we have this duality here where it all feeds together, and things that disrupt the intestinal lining will affect the brain and the pain perception, and things that affect the brain perception or inflammatory process will affect the gut. So we have this circular thing. And like I mentioned before, as far as the pain experience, you can have that local mechanical inputs, that you stub your toe and you have that local inflammatory process. But our pain experience it has to do with the state of our brain, right? So it sends the neurological messages up to our brain. And if we have no brain, we have no pain perception, even if we have this localized response. But if we have a pre-existing condition where our gut-brain axis is already disrupted because we have an intestinal permeability problem, you can see how this cycle sets you off for potentially chronic pain states. So the question about whether inflammation is good or bad, I put together this chart with this natural bell curve where we have healing on the y-axis, and on the x-axis we have inflammation. If we have no inflammation, so no immune response, no inflammatory response, or we block it altogether, you have no healing, you have no cellular turnover, you have no recovery. Whereas if we go to the other end where we have too much inflammation or an out of control inflammatory response, we're at risk for autoimmunity, poor healing, and chronic inflammation, right? Chronic pain, sorry, and potentially inflammation. There's this sweet spot where we don't want to turn our inflammatory or immune system all the way off, and we don't want to let it run haywire. We want it targeted. We want it to do what it's designed to do and stay out of those danger zones. So there's this spot of inflammation where the optimal healing and recovery can occur. How we can achieve that has to do with that intestinal integrity and that gut-brain axis health. So I talk a lot about when I did my original research, I was focused on lifestyle interventions that promote healing and pain reduction naturally. And that includes nutrition, movement, sleep, connection, which really is that sort of stress response issue, and then supplements. Today, I'm going to talk about those causes of what causes from those different areas in life that cause that intestinal permeability. But I will focus on the supplement because I want you to understand how our supplement helps promote intestinal integrity. So let's talk about food. What type of foods can cause intestinal permeability? A diet high in trans fatty acid, deep fried foods, margarine, heavily processed hydrolyzed fats, excessive additives. The disruptors of the microbiome include nonsteroidal anti-inflammatories, which is an over-the-counter, as well as PPIs, which is the proton pump inhibitors, a common reflux medication. Excessive refined sugars, even infections or bacterial or viral infections can disrupt that intestinal integrity. And then alcohol, we'll talk a bit more about that when we talk about sleep in a little bit, but alcohol consumption affects the intestinal integrity. Other foods that create problems with that intestinal barrier function are gluten. One type of gluten is a gliadin protein, which is the gliadin protein is considered gluten from wheat products. They did a study where they took biopsies of the gastrointestinal system they had a group of people who were normal, then they had a group of people who were celiac, which is an allergy to gluten, active celiacs, then they had celiacs in remission, and then they had something called non-celiac gluten sensitivity. So they have gluten sensitivity, but they do not have an actual allergy. They took biopsies and then they put them in a petri dish, I believe, and then put the gliadin and looked at those tight junctions between those enterocytes. All of the exposures increased intestinal permeability, meaning that regardless, but what was interesting is that the cells that were the most permeable were those ones that were non-celiac gluten sensitive. And so it's interesting too that when I'm working directly with clients, the gluten type foods have an opioid-like effect, addictive type effect with the exorphins and the brain effects. So they almost have a withdrawal sometimes. Heavy use of gluten is associated with increased frequency of autoimmune diseases. It also is associated with increased oxidative stress and microbiome. This is not to say that everyone has to be gluten-free. I bring this up because the data suggests that it's at least worthwhile during that recovery or pain, reducing gluten intake. Some people really need to avoid it altogether. I would say that's probably a majority, but you will also notice that if you're set up in a chronic pain state, that people tend to have improvements overall. And regardless, eating nutrient-dense foods is far better than eating nutrient-depleting foods, and you don't get much from gluten types foods. Here's another diagram from Lerner related to the systemic effects of that intestinal permeability problem, leading to increased inflammation, oxidative stress, and such in the molecular responses. Another cause of intestinal permeability, as physical therapists, we really love exercise, which is really good. But sometimes, and in specific situations, too much or too intense can create intestinal permeability. Specifically, over 80% of your VO2 max, things like heat stroke or excessive exercise can disrupt that barrier function of the intestinal lining. And vitamin D deficiency is also associated with intestinal disruption. And I wonder if that's not getting enough movement out in the sunshine. And you wonder if too little exercise would also create intestinal permeability problems. And I did find a study that suggested that may be true. And so I put this diagram together. It is not from a study, but like that reverse bell curve, where on the y-axis we have the amount of intestinal permeability, and the x-axis is exercise load or intensity. So if you think about not enough exercise or even gravity leads to intestinal permeability. So people like astronauts tend to have more of that intestinal permeability problem. It's an interesting concept in that anti-gravity situation. I'm thinking about even couch potatoes, like not enough can produce intestinal permeability. And then that too much. There's a lot of cardiovascular, actually looks more like a reverse J curve related to cardiovascular health and exercise intensity. So not enough exercise and you have a higher rate of cardiovascular incidence. And there's also a sweet spot where you reduce that cardiovascular incidence, but it's really not as much as we think it needs to be. I think it was something like a minimum of 4 to 5 hours a week, but it doesn't even have to be that intense to get the health benefits, because as soon as you get much more into that higher intensity, you get actually showing more risk of cardiovascular issues. And in this particular case, the data I found was that 80% of VO2 max. But you think about those chronic cardio folks, I wonder if they'll find that there's a lot of that, their health, reduction in health issues is associated with intestinal permeability. So the sleep-wake disturbances, that sleep-wake disturbance disrupts the epithelial barrier and the microbiome. Associate those circadian rhythm disruptions with a high-fat diet is also associated with osteoarthritis-like pain. The alcohol consumption, like I mentioned before, increases the permeability, maybe not as much as directly because of the consumption of the alcohol, as much as that alcohol's effect on our circadian rhythm, because it tends to affect those circadian gene expression, which is a tricky problem because there's a fair amount of increase in alcohol consumption, particularly during pandemic times. And then there's stress, can affect the intestinal permeability. Psychological stress, but particularly even stress in combination of nonsteroidal anti-inflammatories. So if we think of a lot of our patients who have an injury and then they're stressed because they're not able to do their activities, they're not able to work, that is in of itself a stress, paired with taking an over-the-counter non-steroidal anti-inflammatory disrupts that microbiome and increases the permeability, right? And then if we think about surgery, that too is a stress, right? Like it's potentially a good stress to get a problem fixed, but it's still stressful. So now what? We look at that and we think, wow, that stresses me out. There's a lot of things that we commonly do in our lives that can cause this permeability problem, intestinal permeability problem. But if we look at desserts spelled backwards, stressed spelled backwards, it's desserts. So stressed is desserts spelled backwards. So I use this analogy again. We're talking about, this is all coming from my study into that chronic regional pain syndrome, about some sort of causative effect that we're missing in that recovery phase. And so while we're stressed about this information, if you've ever had a kumquat, it's this tiny little, it's like nature's Sour Patch Kid. It's really a fascinating fruit. So when you first bite into it, it's really sour and tart, right? So this information is really sour and tart. And then the more you chew it, the sweeter it becomes because we're working through it. So I've also used the comment, the solution is in the cause. So while a lot of this information seems to be stressful, it's giving us a lot of information on how we can improve as far as lifestyle components that can improve healing and reduce the pain naturally. Now, for the sake of this talk, I'm not going to go into those specifics of each of those lifestyle factors. We're really going to focus on the supplement and how VitaKinetics was designed to help support that gut-brain connection. But I do use this analogy of baseball. And if you think about your patients, not everyone's going to be able to do all the right things at all the right time during a stressful time, but everything counts. So if you do one of those things, it's like a base hit. You do 2, it's a double. 3, it's a triple. 4, it's a home run. All 5, and you get a grand slam. So in that whole scheme of things, every little bit counts. But say your patient is really struggling with sleep because they just had shoulder surgery. There's only a little bit you're going to be able to do about that positioning problem for a period of time, but you can still help them work through. And that's also where supplement can come in to support during a time when we can't control everything at that moment. So we'll focus on that. Our supplement, I'm going to focus in on the very specific components that are included in VitaKinetics, and I'll go over those reasons. So the first is turmeric. We actually use curcumin, which we'll talk in a moment. Turmeric is COX-2. It's a different inflammatory pathway inhibitor. So it's anti-inflammatory at 1 gram per day. It has antiviral properties, including decreasing SARS-CoV-2, COVID and viral replication. Improves wound healing and improves intestinal barrier function by promoting those tight junctions at 500 to 2,000 milligrams a day. Some problems are that the curcumin is more readily absorbable over turmeric, and curcumin is the active form of turmeric. Okay, mechanisms of action are still not fully understood, but no known drug interactions. It does have a mild anticoagulation effect, so that's important to know for particularly the older population and potentially pre-op folks. There have been some reports for potential liver problems, so people with liver disease might need to talk to their doctor. However, those folks are taking high dosage, and what's included in our VitaKinetics, again, is the curcumin, which is more readily absorbable, and at the minimum effective dose for safety and effectiveness. Vitamin D3 is also included. It is naturally converted of the cholesterol in your blood by the exposure of UVB rays, which is at this time of year difficult to come by depending on where you live. But vitamin D3 supplementation seems to preserve the barrier function in the intestines. It decreases pain, particularly in women with chronic pain, at only 500 IU. Apparently, deficiency is very, very common, and particularly at high altitude. So where we are here in Reno, it is expected. And I'm not sure exactly why that is, if that's a problem with the altitude and absorption, if it's because of sunblock use, I don't know for sure. And that deficiency in D3 is a predictor of increased pain states. To increase your serum levels, you need to supplement at 2,000 IU. Greater than 4,000 IU is required for a decrease in disease risk. As vitamin D3 supplementation has been associated with reduction of poor outcomes with the COVID infection. Therapeutic dosing is 5,000 to 10,000 IU per day. But I do recommend, if you're going to supplement more than 1,000 to 2,000 IU on a regular daily basis, while we can get this gut and pain improvements with lower doses, which is what our goal is, to make it safe, you do need to have your levels checked. For the sake of VitaKinetics, we are at again, the lowest effective dose to promote the intestinal lining integrity and pain reduction and safety, because it is a fat soluble vitamin. Toxicity is extremely rare. And at the doses we have included, not a problem. Vitamin D3 doesn't change the course of certain disease processes, but it does appear to decrease pain. And I do recommend testing. If you really suspect someone is severely deficient, then they need to have their blood levels tested. But even at the low levels, the therapeutic levels we have included in our blend, there is no contraindication that there's danger in doing that daily. And then we have vitamin C. And again, we're going to circle back on that chronic regional pain syndrome patient, because dosing with vitamin C appears to reduce the risk of development of CRPS, and as well as reducing opioid use postoperatively. There's a few different systematic reviews that demonstrate benefits at different levels. The integrative practitioner clinician recommends using the vitamin C up to higher dosing to get a bowel response, and then you back off. But for pain reduction and for benefits and reduction of chronic pain risks, levels don't need to seem to be that high. Improving of vitamin C status also appears to have positive effects on sleep. And so that's really interesting too. Certain problems that have come up, that there's the thought that there's a rebound scurvy as you're taking vitamin C, and you stop suddenly, that you would have a rebound scurvy. That is not proven. Toxicity is also not validated because it's water soluble, so any excess is peed out. Again, side effect of loose stool, again, you would just reduce the amount, but at the amounts we're talking, we're not even anywhere near to bowel tolerance. And again, precautionary, while our levels are low enough that should not be problematic. If you do have someone who's on dialysis or something like that, then it is worth considering talking to their doctor. I will mention too that a whole orange has about 100 milligrams, but if we look at some of the CRPS data, we're talking about 500 milligrams being beneficial for this postoperative foot ankle pain. You would have to eat 5 oranges, and that is potentially a difficult thing for folks to do to get to a therapeutic level, eating a whole food, which I always recommend eating whole nutrient dense foods. That's always a part of the plan of recovery. And then systemic enzymes, particularly proteolytic enzymes, help break down protein. There's a couple, we use a blend that includes bromelain or papain, which are fruit-based. A randomized controlled study combined with the vitamin C showed a 70% decrease in wound healing time. Problems can be if you happen to have an allergy. And again, for patients who have liver failure or liver disease, it might be worth discussing with their doctor. Okay, probiotics. I'm going to include probiotics, although it's no longer an ingredient to VitaKinetics. because we'll be using we use a prebiotic, very specific prebiotic fiber. But the idea here is that as we promote the healthy microbiome, we have specific health benefits related to improved gut and mental health. Probiotics have been associated, have not shown an increase in infection rate following surgical procedures, and that you have this leaky gut protection from the effects of the non-steroidal anti-inflammatories. There's also shown to be improved DASH or pain and CRPS scores for distal radius fractures while supplementing with probiotics. Bacterium have been shown to have significant health benefits from those specific strains. Okay, and the negative here, and one of the reasons why we made a shift was that following a use of antibiotics for whatever reason, using probiotics seems to, while it doesn't change all those positive effects, seems to increase the time for the host microbiome to be restored naturally to their host. Now, that may actually be beneficial, but what we choose this arabinogalactin prebiotic fiber, which feeds a very specific healthy bacteria in the gut, and that there have been demonstrated positive neuroimmune alterations with the improved gut microbiome with a prebiotic fiber. Paired with vitamin C, it also enhances that activity. It supports that healthy microflora, including those healthy strains, but it also improves the shelf stability and allows a lot more flexibility with taking, because the live bacteria really need to be refrigerated and can't be associated with heat. So they have a lot more die-off. But the benefits of improving the gut microbiome have that gut integrity and mental health, that whole gut brain axis is improved. So online in 2019, the Journal of American Medical Association posted this about the supplements. Supplements can contain ingredients that are toxic and may cause harmful reactions with medications or other supplements. Supplements are weakly regulated, and a balanced diet provides all the vitamins and nutrients. I would agree with that to a certain extent. And then when you should be considering is when you're becoming pregnant, certainly. If you have osteoporosis, certainly. If you have a B12 deficiency, certainly. But the question is gastrointestinal conditions. Well, based on all of our lifestyles, suggests that most of us have a gastrointestinal condition that might warrant, if we're dealing with intestinal permeability and that leaky gut problems, that it would suggest we need to have additional supplements. Now, having said that, they're not supplements aren't FDA regulated, but you need to look for your supplements that have a statement or a stamp about good manufacturing practices, because that ensures product consistency and quality, or NSF International, which is a third-party verification. Good supplements know this. Most supplements have looked at this. And so you need to make sure you're paying attention to that quality. And many supplement or vitamins and minerals can be consumed in the whole food. And I always recommend a whole food-based diet, but you might not meet the therapeutic levels, particularly like trying to eat turmeric. I mean, how many people actually cook with turmeric in America to meet a therapeutic dosing? And again, I mentioned with vitamin C, and one orange equals 100 milligrams. Well, I highly recommend eating said orange, and all the things you're getting from eating that don't outweigh the supplement of vitamin C, but the dosage does matter if you're looking for a therapeutic benefit. And most of our current processed foods, and even the way we grow our current foods, would suggest that we might be more nutrient depleted. And so supplements do make sense. So these are some of the stamps you potentially are looking for. VitaKinetics is manufactured in a GMP certified facility. Ingredients are tested before manufacturing. And we are currently in the process of testing for gluten-free. While we don't have a stamp on our label, it's just a technical challenge right now that we are working towards that, but none of the ingredients are derived from wheat and gluten. And with those good manufacturing practices, you're ensuring a reduced cross contamination. So the question becomes, does it work? You wonder, okay, well, so this sounds great, but does it actually work? There is a branch of the NIH that's really looking into a lot of these lifestyle medicine sort of practices to see what their health benefits or disease benefits are. We'll focus here on clearly VitaKinetics, but here are some testimonials we've received so far. You can go to our website to get much more. But Connie, 42-year-old female, she had a congenital heart condition from childhood. She had severe hip arthritis requiring a total hip replacement. And with using her supplements, the VitaKinetics supplements, she got off her pain medications by day 2. She did try to include all of her things here about trying to manage her stress, promote the best sleep she could, movement with her physical therapist, and strong nutritional profile and eating nutrient-dense foods, including animal sources of protein. For that period of time, she really focused on that, and she's done phenomenally. And she's continued to use her supplement to help her support her stressful life, her work-life balance through a pandemic. We've got our friend client who is an avid mountain biker. She's a mother, professional. I believe she's about 50 years old. And she uses VitaKinetics not for specific recovery per se from an injury or surgery, but she uses her VitaKinetics daily as just a regular recovery tool. And she notices after intense workouts or rides that she is not sore, she recovers much better. She can get back on the bike sooner. And as she's aged and she was noticing that she was starting to slow down and her recovery was taking longer and longer, this seems to help keep her in that sweet zone. Dr. Tammy is an integrative dental practitioner who focuses on TMJ, sleep, and really includes that lifestyle. So she's working on that mechanical position of the airway with the TMJ and sleep and such, but she includes lifestyle interventions. And she has found that having that supplement as a complement to her protocol, that even when people aren't able to make the significant nutritional changes, because that's a challenge for some of her patients, that having that supplement there helps promote an overall healing and improve their symptoms. Then we've got a young gentleman who had a football injury. I believe he was 16, and his mom was really concerned about the use of opioids post-surgery. And so she got her son on the VitaKinetics and was able to get him rather quickly within the first week off of the pain management. And as we know, in a naive patient, he's in that really danger zone for developing addictions. She really kept him for that 3 to 5 day or less, and transitioned to Tylenol and using the VitaKinetics, and he's really done well and continued to use it for quite some time. He's back to playing sports. And I know that his parents both use it as the VitaKinetics as a stress management. But also with a young teenager, it's also hard to really control every bit of their nutrition, particularly if they're starting to go out and depending on how they eat. And so I know she really focused on VitaKinetics. And we've got a grandmother, super active grandmother, who was prompted to try VitaKinetics to see if it would help with some of her leaky gut problems that she'd been working with an integrative practitioner with for a while. So she started taking it regularly, and she started to improve her energy and her mood and feeling really good. And she even followed up with her integrative practitioner. She follows up every year. She'd been taking the VitaKinetics for, I believe it was 4 or 5 months, pretty consistently daily. And her test results were coming back showing improved thyroid numbers as an indicator of her intestinal integrity. So we don't have randomized controlled trials at this point. That's a bit tricky, but we do have a lot of stuff coming in from people who are taking it and noticing that their pain's improving, their recovery's improving, and that their overall, their health is feeling good. And as a clinician, that has been a very valuable tool in aiding recovery for patients. I don't have a couple of our physical therapists as well are using it for their active athletes and such too. So as a clinician, it's always nice to have all these wonderful things, but as you know, you can invite all, work with the willing, and meet the rest where they are to create better outcomes. You can lead a horse to water, but you can't make them drink. And where VitaKinetics really plays a role is it's another tool in your toolbox where you can work on the mechanical issues or the neurological issues and try to talk about certain lifestyle issues. But there may be areas where, you know, stress is just a part of their life right now, and they are not able to really get a handle on it for whatever reason it is, temporary or long term, and that the supplement can help support that gut brain access, so you can get more out of your physical therapy. Or you have somebody who's really trying to work on getting off of the pain medicine, and you suspect that it might be related to the stress or what have you, that this can be a tool that someone can use to manage some of those issues. So I want to say thank you for joining me today on your lunch hour. Again, if you really are interested in some of the research articles, primary articles, please reach out to me at carolyn@vitakinetics.com. On our website, on our blog, we do have links to many of the primary research articles as well. You can follow us at VitaKinetics on social media. And I look forward to helping you in your clinic. We will be soon providing options for people to sign up to be retailers if you want to have product in your clinic to sell. We have found with the clinicians who do have it that they are really appreciative of having that available to them immediately versus ordering online. We can also work on giving you a specific code if you don't want to provide the product in your office. You can order online at VitaKinetics.com. We are currently waiting to be restocked. Should be at the beginning of December, we'll have availability. And there's subscription options to use so that it's delivered to your door once a month. You have some flexibility with varying that, and that gives you a cost savings. We have free shipping for all products online. So please reach out and check us out, and we look forward to hearing from you. All right. Well, thank you.